So, yesterday I got into an argument with somebody on Facebook, which I realize is a fatal mistake in and of itself from the beginning. Especially, well, the argument was over the Supreme Court decision on the individual mandate that is part of the Affordable Health Care Act, more popularly known as Obamacare. So, I got into an argument with someone who is very clearly a conservative radio fan, a Tea Party member. And it's pointless to argue with people like this over certain topics, especially anything concerning President Obama, because they are very passionate in their views, they're very emotional, they're very attached to them, they're very afraid, and they're convinced that society as they know it is under attack and threatened. So it's very hard to actually have a debate with these people. I'm not going to talk about the merits of what they believe in or whatnot. I'm simply talking from an emotional standpoint. The arguments tend to get very emotional very quickly, and you get accused of being ignorant and not knowing what you're talking about, and that you need to go back to school, which is kind of amusing because they generally seem to be very derogatory towards public education. But anyway, one of the things that came up in this conversation, well, two things that this gentleman said before I walked away from the conversation. The first was that in response to me asking who is going to pay for people who are uninsured and who go to hospitals for treatment, who's going to pay for that? And his first assertion was that people who don't have insurance are either illegal immigrants or lazy and unproductive. Okay. Second, he stated that people who are sick but don't have insurance they don't have to go to the hospital. They could instead go to a free clinic so that taxpayers aren't paying for their health care. And I didn't really feel the need to go through the effort of explaining to him who pays for free clinics. But anyway. So, I want to talk specifically about the mandate and the requirement that everybody carry health insurance real quickly, just in a way that perhaps maybe I can get someone to really understand this. Okay, so we accept that society as a whole, civilized nations, civilized countries, when you are very, very sick, you've been in a car accident, you have cancer, you're vomiting blood, whatever, if you do not have the means to pay for the medical attention that you receive, you will still receive medical attention. You will not get the best care, you will not, by any means get absolutely amazing stuff, but if you're bleeding and you end up in the emergency room, they will patch you up and send you out the door so that you do not die. Okay. In countries that have universal health care, everyone pays into the system in one way or another. The government pays for the health care. That money that the government has comes from taxes that the citizens of those countries pay. Everyone pays for health care. So when anyone goes to the hospital, those costs are defrayed by the fact that everyone is paying into the system. Now, here in the United States, where we do not have universal health care, we still hold on to the cultured, civilized belief that a sick person, a very sick person who goes to a hospital, should be cared for, should be fixed. Again, they're not going to get the best care, but they should have their fears their illnesses addressed. If they have cancer, they will get treatment. There's no guarantees for great health care, but they will be covered. They will be paid for. But because of the fact that these people do not have insurance, those of us who do, and who do have the means to pay for our medical care, have to pay more to cover the people who don't contribute to the system. This is one of the reasons why our health care continues to rise, because we are covering people who are not contributing to the pool of health care dollars that are available to pay for our care. hospitals, and even so, okay, so you go to the hospital and you can't afford to pay your bill right away, but you make payments and you're trying to make good with it. And, even that is a loss leader for a hospital, because there's administrative costs involved in making sure you continue to make your payments and sending you out notices and all that other stuff. They lose money on people who don't have the ability to pay. Okay. And then you have the people, so you've got two categories of people that generally fit into that, so kind of three as a general rule. You have tourists, people who come from out of country, okay, you have illegal immigrants, and people who cannot afford to pay for health insurance or health coverage, can't afford to pay for health insurance and do not qualify for Medicaid. They make too much money for Medicaid, they don't make enough money to buy a health insurance policy that's worth anything. So then you've got the people who don't feel they need health care, okay? And I'm in my mid-20s, I never get sick, my family never gets sick, so I don't need to have health insurance at an unnecessary expense to me. Cool, that's great. You don't have to pay for that money. But if you're in a car accident at 25 and you end up in the hospital and you're bleeding out and they have to fix you and you end up being admitted and you stay there for 4 days and you run up a $20,000 bill and you don't have $20,000 laying around to pay for it and somebody else to cover it, the fact that you have, that you have made this willful choice not to have health insurance still ends up costing the taxpayers money, because now taxpayers have to pay for the fact that you did not have health insurance to cover your medical bills. So, this is why it is imperative that everyone contribute to the system. Now, there are those who believe, people who think that, hey, I don't have, I have a job, I can afford health insurance, I shouldn't have to cover all those other people who can't afford to pay for it or who are here illegally or whatnot. It's not my problem to cover them. This is a free society and I shouldn't be forced to pay for people who can't cover their own medical bills. All right, cool. That's a valid point. That I don't agree with it. That's a valid standpoint. Here's the thing, though. In order to have that stance, you have to be intellectually honest with yourself. And you have to say that your stance is that if someone goes to the emergency room, has been in a car accident, is bleeding out, has organs falling out, they're dying, they're gonna die, if they don't have health insurance and they don't have the means to prove that they could pay the bill in the hospital, that the hospital throws them out the front door and they die on the steps of the hospital. Yes, that is a dramatic way to explain this problem, but it is what it is. If you think that people should have the ability to opt out of having health care, and you think that no one in society should ever be forced to pay for the health care of another individual, then you need to take the intellectually honest stance of saying that you think we should let people die. Period. Now, if that's what you think, fine. That's your opinion. I think you're wrong, but I disagree with you. But I think that a lot of people are being intellectually dishonest with themselves right now, because if something happened to them and they didn't have a job, or one of their loved ones didn't have a job and they didn't have health insurance and they went to a hospital and they couldn't afford to pay their bill when they got to that hospital, you're damn right they wouldn't want their family or themselves put out on the street to bleed to death. And if you can't think outside of your immediate situation, and you can't appreciate the fact that you're not always necessarily going to be in a place where you can afford health care and whatnot, you maybe need to think again. That's all I'm saying. So anyway, that's my little video rant about health care, and it's 9 minutes long, and I didn't intend for it to be that long, and most of you probably didn't watch it. But I felt like I had to get it out of my system.